Indirect exposure to trauma is an occupational hazard for those working with individuals who have experienced trauma, including health and mental health professionals, child welfare workers, and first responders. Exposure to other people's trauma can cause intrusive thoughts, a rehashing of traumatic stories, distorted thinking, and mood changes. Together, these symptoms are called secondary traumatic stress, affecting 15 to 50% of workers. STS risk factors include how much trauma a worker is exposed to, the type of work they do, their risk factors, and life experiences. STS can lead to significant distress and even post-traumatic stress disorder, a serious condition. To guard against STS, workers who are exposed indirectly to trauma must do what they can to take care of themselves. But self-care isn't enough, and there will always be an elephant in the room. That is, what's going on in the organization. When exposure is high and stress isn't managed properly, it not only hurts the individual, but also creates pressure on the organization.
Why does it seem like you spend most of your time in bed, lying down and not doing much lately? Are you someone who easily gets tired and doesn't feel like doing anything? Do you label this kind of behavior as mere laziness and nothing more? There's actually a lot of overlap between laziness and burnout that can make it difficult to differentiate between the two. Burnout is a negative state of emotional, physical, and mental exhaustion caused by excessive stress and inability to cope with it. And as of 2010, a survey reported that approximately 75% of adults in the United States alone have experienced symptoms of burnout, with over 40% of cases being more severe. Now, more than ever, it's become imperative to educate and better understand the nature of burnout.
Cramming for a test? Trying to get more done than you have time to do? Stress is a feeling we all experience when we are challenged or overwhelmed. But more than just an emotion, stress is a hardwired physical response that travels throughout your entire body. In the short term, stress can be advantageous, but when activated too often or too long, your primitive fight or flight stress response not only changes your brain, but also damages many of the other organs and cells throughout your body. Your adrenal gland releases the stress hormones cortisol, epinephrine, also known as adrenaline, and norepinephrine. As these hormones travel through your bloodstream, they easily reach your blood vessels and heart. Adrenaline causes your heart to beat faster and raises your blood pressure, over time causing hypertension. Cortisol can also cause the endothelium, or inner lining of blood vessels, to not function normally. Scientists now know that this is an early step in triggering the process of atherosclerosis, or cholesterol plaque buildup in your arteries. Together, these changes increase your chances of a heart attack or stroke.
Post-traumatic slave syndrome is an explanatory theory that really looks at multi-generational trauma. One of the things that's difficult for people is their first response is, oh my God, that happened so long ago. We're talking about people being captured, shipped, sold, beaten, raped, experimented on. And then you have to ask the question, did the trauma continue? Yes. So 300 years of trauma, no help, freed. No help, more trauma. If it's a sustained trauma, then the impact of that is also sustained. When we look at multi-generational trauma, we're looking at people who are maybe victims of natural disasters and their families and their children and generations of folks who have experienced war. And we know that there are residual mental, emotional, traumatic impact. And what I did was I started to look at the African-American experience, starting with slavery, as a real clear, long enduring trauma. So I started to see that there were clear connections between that survival behavior and contemporary living in African American experience. I started to see common behaviors that I took for granted as, well, cultural. There's adaptive behaviors, post-traumatic slave syndrome. PTSD is a disorder that occurs as a result of a single trauma. You don't even have to be there to actually get a diagnosis of post-traumatic stress disorder. You could just hear about something horrific happening to someone you love. So you have people who have experienced it firsthand, people who have witnessed it in their environment, right? People who are continuing to be oppressed. That exacerbates any possibility of healing. So it's not post-traumatic stress disorder, because then it becomes part of what we call your socialization process. So you begin to normalize a way of living and being, everything from what we eat to what we believe it means to be a friend. You know, all of these things are colored by history. And if you don't understand it, you're going to fold in things that you've just assumed are normal. But post-traumatic stress disorder, you know, exaggerated startle response, outbursts of anger, feeling of foreshortened future. There was a point where there were African American children in different urban settings that didn't expect to live to be adults because they saw so much death, that they started planning their funerals like at 13, 12, as young as 10. When you start looking at the simple biology, you start looking at the impact of stress on health. And while we look at general stress, you know finances, you have illnesses, all these different things. How about being Black? How does factoring in being Black in America impact your stress level and therefore your body's ability to operate its own immune system? Because we know it compromises the immune system. Once you understand it, then you can deal with it. Because you see, it's habitual. You socialize. It becomes part of your being. So one of the ways you begin to address that multi-generational trauma is to work with the people it directly impacts, to hear from them. And when you give the people the information, they can use it. I think the first order of business is beginning to have a conversation. And the other is to educate the larger society. You have to stop the assault. So this is not purely a clinical thing. This requires social justice and change. That's where part of the healing is. It's not in a clinical setting or in a pill. It's in fairness and justice and safety and equity. We got to work with some of those clinical things, some of those issues of panic and anxiety. And we also have to deal with the fact that you have a system that is set up to oppress you and to continue to injure you. Both those things have to be dealt with. And it cannot singularly by themselves affect a change. They have to be done collectively.